Hi, my name is Pam Busher, and I did my post-conference lecture on Clostridium Difficile. I have been a nurse for 26 years, and my experience includes labor and delivery, postpartum, outpatient surgery, pain clinic, infection control, multi-drug resistant organism coordinator, quality management, and employee health. I graduated in 1996 with my bachelor's from Northern Michigan University. I do not have any teaching experience outside of my place of employment, but do several presentations on infection control topics at work. This semester I did my practicum at Rennes Skilled Nursing Home Rehab Center. While doing my practicum, I reviewed the course material and learning objectives. The students had one simulation exercise that counted as a clinical day. The topic of the simulation was related to a patient with C. difficile. As an infection control nurse for the past 12 years, this was a topic I was familiar with. I decided to do my post-conference prior to the student simulation so they would be able to relate my lecture with their simulation exercise. C. diff is the most common infection acquired in the U.S. hospitals, which can lead to medical complications ranging from painful diarrhea and death. Nurses have the most contact with patients, so they are at risk for transmitting C. diff from one patient to another. I focused my lecture on preventing the spread of infection, including hand hygiene and standard precautions. Many times, nursing students are not exposed to patients with C. diff during their clinical rotation. My goal of this training was to reinforce skills and knowledge in managing a patient with C. diff. My students were second-year BSN students. Ages ranged from 19 to 38 with a variety of personalities and backgrounds. There were 2 LPNs in the clinical that had knowledge of C. diff, but this information was fairly new to most of the students. All the students were eager to learn, kind, caring, funny, and spirited. Rennes Nursing Home prides itself on being a family-owned business, with the Rennes family opening its first facility in the 1970s. They are dedicated to providing high-quality personalized care to meet the growing needs of residents in central and northeast Wisconsin. My post-conference lecture was held in a well-lit conference room within the nursing home. The room was a perfect setting for a small group discussion where we sat around a large table. By the end of the lesson, the learners verbalized they had increased knowledge of C. diff and caring for patients. My learning objectives included explaining the signs and symptoms of C. diff, recalling how C. diff is transmitted, remembering appropriate cleaning agents for patients with C. diff, identifying appropriate personal protective precautions, describing C. diff and its risk factors, describe appropriate hand washing agents and techniques. In preparation for this lecture, I provided the students with a link to the CDC C. diff guidelines to review along with the simulation scenario they would be doing later in the semester. I developed handouts and shared them with the students. To assess my plan, I gave the students the opportunity to complete a pre-knowledge assessment, which included the same 10-question quiz to use as a comparison. After completing the training, the students answered the 10 questions again, and we followed it up with a group review. All students scored 80% or greater on the post-quiz. The students completed the quiz and followed it up with this group discussion. Time is limited during a post-conference, and it was hard to keep the lecture to 15 minutes. However, my preceptor knew the students would have lots of questions about this topic since they were preparing for their simulation exercise that had to deal with a patient with C. difficile. So my preceptor gave me approximately 25 minutes for my post-conference lecture. If I would have had more time, I would have done a game with donning and doffing PPE so the staff could practice proper technique. However, we did have a patient on the nursing home unit that had C. difficile, so I was able to observe the students donning and doffing PPE and give them immediate feedback as needed. The presentation went well and the students asked great questions. Reviewing the quiz allowed the students to reflect on the meaning of their learning experience and engage in discussion as a group. The group review confirmed everyone understood the importance of proper nursing practice when caring for a patient with C. difficile. Thank you very much. If you have any questions, please let me know. Happy graduation to everyone, and I hope you are successful in the years to come with this new degree.